Want to remove your moles but are unsure of the options? Well, here are the 4 ways in which you can remove your mole cosmetically, and the 4th is our preferred method. The first option is cutting and stitching. Now, this is perfect for lesions that are large and irregular, those ones that we suspect skin cancer, so we need to cut those out properly. The reason we need to do that is we need to send it to the pathologist to have it looked at under the microscope to see if we need to cut further areas out or to see exactly what it is. Is it a cancer? What kind is it? Do we need to do further management? When we cut and stitch though, there is 100% risk of a scar because we cut all the way down to the layer of the fat to make sure we get the whole skin unit all the way down to the dermis, and then we stitch that together. Now, in the hands of the world's best plastic surgeon, you're still gonna have a little scar there because you have to oppose the edges perfectly. Often you're gonna have tension on the wound over time, and that's going to cause a scar. Now, there's ways of us reducing that, but there'll still be a scar there. One of the other benefits of cutting and stitching is that it is permanent. That mole will never grow back because we've taken the whole thing out, so there's no chance at all of regrowth. Now, the downsides of cutting and stitching are there's a high risk of scarring. So there's 100% risk of scar in this area. Now, how bad that scar is, it depends on your own unique characteristics and where the mole is on your body. There is a higher risk of infection. You need stitches. Now, depending on the part of the body that we're cutting the mole out, they can stay in from anywhere from 5 days to 3 weeks, depending on where that is on the body. The next option for removing your moles. Now, this is my least favorite method. It is called liquid nitrogen or cryotherapy. What we do is we freeze the lesion away. Now, some of the benefits of that, it's quick, it's relatively cheap, it has minimal recovery time, and this one does not require stitches or cutting. So some of the downsides are there's a significantly higher risk of scarring, and that also includes hypo or hyperpigmentation. So more pigment or less pigment in there. That's really common with this method. With this method, there's very little control. So I can go too deep and definitely cause a scar. I can go too superficial and not be able to fully get the lesion. Because we're using liquid nitrogen and we're freezing the area, I'd have very little control over damage to surrounding tissues and freezing the surrounding tissue. Think of it like an ice burn. So that also increases the risk of scarring. And this method is really not suitable for most moles, especially ones that are bigger, more irregular. You really need to shave those away or cut them out formally. The next option is carbon dioxide laser or CO2 resurfacing laser. You can also use erbium laser for the same method. One of the benefits of this is it's quick, there's minimal downtime, and we can shave it down to the dermis layer of the skin. Now, some of the downsides are that there's a higher risk of scarring compared to radiofrequency mole removal. There is less control over the depth than what we'd have with other methods. And there's a very high chance that I need multiple sessions to completely get rid of the mole. Number 4 is radiofrequency shaving of the mole away. Now, this is our preferred method of cosmetic mole removal. It is the gold standard for mole removal cosmetically worldwide. The benefits of this are we can shave it down to the dermis and let it heal like a graze, which is the best method for scarless mole removal. There is a significantly faster healing and a much lower risk of infection. It is perfect for delicate areas of the skin, like just under the eye, in the hair, any area where the skin is really thin. Radiofrequency shaving is very highly controlled. It allows us to shave away the mole layer by layer without affecting or damaging the surrounding skin. Some of the downsides of radiofrequency mole removal are it is purely for benign lesions. So we do not use this for skin cancer. If your mole has any suspicious features at all, they need to be cut out by a dermatologist. It is not covered by Medicare, neither is any cosmetic mole removal. So these are purely private procedures. About 2% of the time, we expect some regrowth of the mole itself. Now, us cosmetic doctors, we like to lean on the side of being conservative. So we shave down just low enough to take the mole away, but we don't go too low as to definitely scar you. So we always lean on the side of it growing back as opposed to definitely scarring you. In an audit of our clinic, we find about 2% of lesions grow back. If that happens, you come back, we can shave it complimentary.